Yes, definitely. One of the biggest things that I'd like to get across to patients is that there are a lot of normal changes in the eye that cause abnormal symptoms. And probably the biggest thing that we see is the change of the natural lens in the eye. The lens inside the eye, that's back behind the colored part of the eye, grows throughout our whole life. It actually grows little layers like an onion. And as it layers over time, it's responsible for almost all of the normal changes we have as we age and vision changes. It's responsible for us needing reading glasses when we get in our 40s. And then it's also what really is involved with the cataract formation and the changes there. Now that's a great question. There's a lot of confusion about the word cataract. And I've told people over the years that if they made me in charge of all eye doctors for one day, I would remove that word from my vocabulary. We wouldn't use it. We'd replace it with something like age-related lens thickening, because most people think cataract means there's a growth on the eye that needs to be removed. But really what's happening is as that lens inside the eye continues to thicken with the normal growth process, it gradually changes optically. It becomes a lens that doesn't focus as well. And that gradual decrease in focusing quality is what's responsible for giving us the normal changes that occur, but it's also responsible for causing the symptoms that we refer to as cataract. And the word cataract is really an ancient term that was related to the fact that the ancient people noticed that the eye turned white internally when it was advanced. And they felt that that was due to the fluid in the eye becoming turbulent. So the only word they had for, in Greek, turbulence of fluid was the kind of turbulence you saw in a waterfall. So the Greek word for cataract, for waterfall, is cataract, and that's why it carries that term with it. So it's really an outdated kind of archaic term, and we like to prefer thinking about it as a age-related lens change. The normal symptoms that we all experience that sort of predate the full-blown cataract symptoms are the kind of things that people notice in general. They need more light to read with, have more trouble driving at night, don't see quite as well in glare, having trouble with glare or halos. So a lot of the normal changes that occur in that normal lens thickening process are responsible for that. When the lens gets thick enough that it optically is cloudy, you can have an accentuation of that and difficulty where night driving becomes even more difficult and uncomfortable. Trouble with contrast sensitivity, the ability to distinguish subtler shades of contrast. You can also have differences in color perception, because one of the common things that occurs as the lens thickens is it turns yellow, and that yellowing causes a change in the tinting. So people tell us after cataract surgery or lens replacement surgery that the colors are a lot more dramatic than they used to be. Great question. If we think about what cataract is, that lens thickening that occurs, the treatment that's available is lens replacement. So we think about cataract surgery really as lens replacement. The techniques have just really advanced over the past decade to the point where now we do the lens replacements without having to use any shots or needles. It's outpatient. The anesthesia is very light, so it doesn't cause any lingering side effects. Recovery is quick, and it's a painless process. So that's the biggest advance we see. We see our role as twofold. Not only are we providers of care, we evaluate and treat the conditions of aging, change of the lens, or cataract, but we also provide surgical care. The third aspect of that is the educational aspect, because I think it's really important for patients to have access to providers that can talk through issues and understand their particular problems and concerns. And the informed patient that understands their condition is really a better patient, and their outcomes are usually better. So I'd encourage them to call our office, our phone numbers, or look us up online and set up an appointment.